The global monkeypox outbreak is spreading rapidly with more than 16,000 confirmed cases worldwide. Yesterday, the World Health Organization declared the disease a global health emergency. The United States has not yet made a similar declaration, but the White House said in a statement that it's a call to action for the world community to stop the spread of this virus. Meanwhile, President Biden is on his third day of COVID isolation. His doctor said he likely contracted the highly contagious BA.5 variant that's causing cases to surge across the United States. Joining me now to discuss COVID and monkeypox is Dr. Anthony Fauci, Chief Medical Advisor to President Biden. He is also the director of the National Institute of Allergy and Infectious Diseases. Dr. Fauci, great to see you. Welcome back to the Sunday Show.
Thank you very much, Jonathan. Good to be with you.
So the WHO said that declaring a global health emergency means the monkeypox outbreak is an extraordinary event that requires a coordinated global response. What kind of coordinated response needs to happen to combat the virus?
Well, there's, first of all, increase in the sharing of information, the ability to mobilize funds that are only mobilized when you are in an emergency situation. It really is a calling together of all the countries in the world to realize that this is something that has already spread beyond the endemic areas in Central and Western Africa to 80 countries. There are 16,000 documented cases. There are about close to 2,900 in the United States. So this is something we've got to mobilize everyone with the resources that they have and be able to move expeditiously to address the problem. With the interventions that we have, Jonathan, we have tests, we have antivirals, we have vaccines. Those are the kind of things that they're talking about getting a global mobilization.
The United States has yet to declare monkeypox a health emergency. Should it?
Well, Jonathan, I'm not going to get ahead of what we're going to do, but I can tell you that we are actively discussing these things literally on a daily basis, including Sunday. So we're certainly looking at this very carefully.
All right, now let's talk about who should get the vaccine. Who should get the monkeypox vaccine in order to protect themselves?
Well, Jonathan, it depends on who should get it and how many doses do we have right now to actually fulfill that requirement of who should ultimately get it. Clearly, people who have been exposed to individuals who are clearly documented or are very, very likely to have been exposed to somebody, we call that post-exposure prophylaxis, similar to post-exposure prophylaxis that we give very often with HIV antivirals. But also, if you look at the truly broad protective nature, you really want to get people who are at risk because of behavior. For example, the men who have sex with men population who, for example, are on pre-exposure prophylaxis for HIV. So the very fact that they are on pre-exposure prophylaxis for HIV would immediately put them into that classification where they very likely should get vaccinated in a preventive way. So there are two pillars to that. One in which you know you've been exposed, clearly those people, but ultimately people who are at risk through sexual networks or what have you, those are the people. So ultimately what you want to do as we get more and more vaccines available to us, and they are coming quickly. We hope that by the end of July, we'll have an additional 750,000 doses of the vaccine, of the Jynneos vaccine, to be given to individuals. So that's what we're talking about pre-exposure and post-exposure prophylaxis.
Before I let you go, we got to talk about President Biden and his COVID diagnosis. The White House physician released a statement yesterday saying that the president most likely contracted the BA.5 variant, has a sore throat, body aches, but his symptoms are mild. The president is 79 years old. How concerned should we be about his recovery?
Well, you always take something like this seriously. But if you look at the situation with the president, Jonathan, he's been vaccinated, doubly boosted, and he is receiving a highly effective antiviral drug, Paxlovid, that has a very good track record of preventing people from progressing to relatively mild symptoms into severe disease leading to hospitalizations and deaths. So although you can never guarantee anything, each day that goes by and the reports that we're getting from Dr. O'Connor, his personal physician, is that he seems to be improving on a daily basis. So all of that is very good news. He'll continue to be followed closely, but literally on a day-by-day basis as he continues to improve, from what we're hearing from his physician, that is a pretty good prognosis.
All right, two questions I got to get you on before I let you go. With COVID cases surging in some regions of the country, should folks be masking up in public again?
I believe that you should look at the CDC guidelines. They're very clear about it, Jonathan, as you know. On their website, they have a color-coded map: green, yellow, orange, and red. And for each of those, there's either masks optional or masks very much should be used. In other words, a high recommendation. So if you live in a zone where, and by zone I mean jurisdiction, county, city, state, where you have a high level of viral dynamics and you are in an indoor congregate setting, the CDC recommends that you should be wearing a mask.
Dr. Fauci, you recently told the Washington Post that you are going to be, you said, by the time we get to the end of the Biden administration term, I feel it would be time for me to step down from this position. Would you like to share when exactly that might be?
Jonathan, I don't know. I'm still considering it. And when I said by the time of January 2025, I meant anywhere between now and then. And literally, you know, right now I'm so busy. So I'm just concerned with monkeypox and with COVID. I mean, I consider this. I talk about it with my family. When I'm ready to make an announcement, I will make an announcement.
Well, you have an open invitation to make that announcement here on the Sunday Show. Dr. Anthony Fauci, thank you very much for coming back.